The aortic arch is a continuation of the ascending aorta. Left common carotid artery arises directly from the aortic arch. Right common carotid artery arises from the brachiocephalic trunk. At level of upper border of thyroid cartilage, common carotid artery divide into external and internal carotid artery. External carotid artery is present anteromedial to internal carotid artery. Thyroid gland present medial to common carotid artery. Pharynx lies adjacent to the carotid sheath. Carotid sheath which contains the common carotid artery. Larynx or voice box is located in the neck. Anterior to the esophagus, superior to the trachea, medial to common carotid artery. Esophagus is located medially, trachea present in midline of the neck, while the common carotid arteries ascend along the sides. Recurrent laryngeal nerve is located medial to the common carotid artery. Lateral to common carotid artery is internal jugular vein. Anterior tubercle of the cervical vertebrae is a small bony prominence on the anterior aspect of the transverse process. Transverse process of C4 is posterior to the common carotid artery. Vertebral arteries primarily pass through the transverse foramina of the cervical vertebrae. Anterior tubercle of cervical vertebrae serve as attachment point for several muscles, including longus colli, longus capitis, scalenus anterior. Inferior thyroid artery is located posterior to the common carotid artery. Inferior thyroid artery cross medially at level of cricoid cartilage. About vertebral artery we already discussed before. Thoracic duct also present posteriorly. Posteriorly and lateral evagus nerve is present, which is part of carotid sheath. Structures anterior to common carotid artery. Superior belly of OMO hyoid cross common carotid artery at level of cricoid cartilage. Anterior jugular vein lie more superficially and medially. The sternohyoid, along with the sternothyroid, help separate the anterior jugular vein superficially from the common carotid artery deeply. Sternocleidomastoid also present anteriorly. Middle thyroid vein arises from the lateral surface of the thyroid gland. It travels laterally towards the internal jugular vein.